So let's talk about the time restraints that you have as a doctor, because this is a big issue, and I think it's one of the reasons why doctors are more prone to, you've got a customer, you've got a patient come in, and you could do one of two things. You could sit down with them and try to get them to change everything that's bad about their life, or you could fill out a prescription and give them the prescription, get them out the door, and go on to the next one and see a patient every 5 to 7 minutes, which appears to be the average here in the States. And so the counseling time, the amount of time that it takes to really kind of get across to someone what they're doing. Are you doing that on an individual basis? Are you bringing your patients in for like a mass class? How are you handling the time issue when it comes to trying to get someone to go low carb in their diet?
Yeah. Look, I think there's to me there's two aspects to that. Number one is not everything has to be achieved in a single visit. In fact, there's a lot to be said for seeing people a few times over a period of a few weeks. And we know that if people attend a lecture or they go to a doctor, within a couple of weeks, they may well have forgotten a fair bit of what you said. So the more you try to load people up with lots of information in one sitting, I'm not sure that always is the way to go. I think doing it in stages is probably better, because you can reinforce some of the ideas at a second and then a third visit, and it doesn't have to be, the next week. It can be after a couple of weeks and then a month. Number two is, and this is something that I have medical students in, and I do say to them, it doesn't always have to take a long period of time to convey some basic concepts and principles. And this comes back to the idea of keeping it fairly simple. So to me, it's not about trying to work out an entire detailed program that says to people, right, we're going to work out what you're going to have for lunch on Tuesday and for dinner on Friday. No, that really is for the individual to do. I see my role as to say, these are the broad parameters within which we want to work. So these are the sorts of food groups you should be having. These are the sorts of portions maybe you should be thinking about. This is the sort of exercise you should be looking at. So we're really looking at setting broad parameters rather than, I'm not a micromanager. Now, other doctors will do things differently, and I don't think there's a right or a wrong, but I don't believe in micromanaging. I believe in saying to people, this is the direction, these are the broad brushstrokes, and there's lots and lots of resources. I mean, there's lots of resources. There are books, there are websites, there are programs. I personally, I don't entirely see that my role is to, with patients, to be the category killer. Part of my role is to also direct them, to other resources and information sites where they can, get some ideas from me and then go further in their own time. I think that's one can work around these issues. There are ways around it.
Good. What about medications? So I know doctors that, not really, I guess functional doctors too, but doctors that are focused on lifestyle first, sometimes it can be difficult when dealing with different medications, because you're trying to get them off medications, but you want to make sure that they're well taken care of, especially in the transition time where they're trying to make these changes to their diet and to their lifestyle. What are some of the markers that you're looking for if you want to put them on a high blood pressure medication or a cholesterol medication or metformin, or some of these medications that you might need for a year or two or a little more before you really, undo some of the damage that you're doing to your body? What do you have criteria? What is it that you're trying to do there?
I seriously, I think the criteria for treatment, particularly with diabetes or with high blood pressure, are broadly the same as anybody else's. I may, I suppose, allow a little bit more leeway than some other doctors before starting medications. But, the overarching aim is not, the overarching aim is how can we get people to improve their health? And there's a number of ways that that can be done. So it's not so much, in my opinion, about should we use medications or shouldn't we use medications. What we should be doing is saying, how can this person best improve their health? Now, in an ideal world, with 75% of the illness burden and chronic disease burden being related to lifestyle issues, then, hopefully at least 75% of the solution should be lifestyle. But, back in the real world, it isn't always like that. So I don't believe in cutting off one's nose, cutting off your nose to spite your face. If somebody's got very high blood pressure or their, diabetes markers are way out of control and there's not going to be some change happening in the next day or week, then that still needs to be treated and managed. We still need to do things to help that person, and they may well need medications. If their blood pressure is, just to pluck a number from the air, 200 over 100, and they're overweight, and yes, we want them to lose weight. We want to do lots of things to help that person do it. But you know what? Until that happens, they may still need some medication. And sometimes an incentive for people, or something that you can say, well, here's something you can aspire to, is either reducing your dose of medication or coming off medication. Yeah. So if you say, well, what parameters or criteria would I use to use medications? It's the standard ones. If the markers are such that they need treatment, then they need treatment. Now, there could be short, medium and long term. And I don't see them as mutually exclusive. I don't think we want to throw babies out with bathwater. Neither do we want to just be reflexly reaching for the prescription pad and ignoring all these other things that really we should be doing and arguably should be doing first.
How long have you been counseling patients to change lifestyle as opposed to kind of the older model to do that? How many years do you think you've been doing that?
Oh, that's a good question. I stop and think about it. Look, probably increasingly over the last 10, 15 or so.
Okay. And what have you? What are some of the results that you've seen?
Again, it does vary, and I think it also self-selects a little bit because, rightly or wrongly, there are people who would also prefer to take a tablet than perhaps make changes. But some of the results that you do see, can be quite dramatic. I've seen people lose. I was going to say 20, 30, 40 kilos. What's that? Sort of, 45, 50, 70 pounds, something like that over a period of, some, 3 to 6 to 9 months. So the diabetes markers, what's called the HbA1c, we can see those go from 8 and 9 down back into normal readings, into normal levels, and people can come off their medications. I remember many years ago, this lady, I think she was in her upper 60s and really, rose to the challenge, if you like. And within a matter of 12 months, she'd come off, I think, 2 different, diabetes medications and dropped about, this is a while ago, and I'm trying to remember, probably, good 70, 80 pound or so. And look, to be fair, there are others who just never seem to quite get there, but, everybody's on their own pathway and journey. And sometimes people come back years later and say, look, I wasn't ready when we spoke about this before, but, I'm ready now.